This is confabulation. I am David, and my pronouns are he, him. And joining me is,
Hi, I'm Pearl, pronoun she, her.
And I'm Jade, pronouns she or they.
and we are at Our Sister's House, a domestic violence organization that provides advocacy and education for victims and survivors of domestic violence. If you or anyone you know is experiencing domestic violence, you can call our hotline at 253-383-4275, our website, or visit our website at oursistershouse.com. And so one of our guests, Jade, Pearl is one of our advocates, and Jade is our guest from Rainier Valley Midwives. And yeah, so, we want to know a little bit more about your organization and, whatever you want to, talk about. So if you can tell us
Definitely.
more about your organization, that'd be great.
Awesome. Yeah. So we were formerly Rainier Valley Midwives. We just changed our name just this year to Rainier Valley Birth and Health Center. We have two clinics. One is down in Renton. It is a birth center. And then we have our Seattle clinic that is just a clinic it has yet to be a birth center, actually. That's still being built right now. But mainly we do pregnancy care and births. But we also do just the whole spectrum of reproductive healthcare in general for people from their first period into menopause. So we'll take care of people who have periods, and those are our main things that we do. We also have a social worker to provide all those social services and whatnot, and therapy. We do yoga therapy and craniosacral therapy. So yeah, we're just kind of a community clinic in that sense. And we started in Rainier Valley in south end of Seattle. And it was started by the executive director, Tara Lawal. And she basically just saw the need for more natural birthing ways for the community here in the South End, specifically the 98118 area code, which is like one of the most diverse in the nation, with all these different languages being spoke. And yeah, she just saw the need for more midwifery-led care for specifically BIPOC communities down here. And just noticing all of the trauma that they've been going through during birth. She's even had some of her own, and people in her family have experienced it. And so she was like, "What is a way that we can do these natural birth ways that don't involve such a medical or clinical factor to it, like you would get in a hospital setting." So she started that with our clinical director, Jodilyn Owen, who's also a midwife. So both of them are midwives. And yeah, they started, I believe, back in 2015. And we've moved all over the place. So we started in kind of near Othello. And then now we're here on Orcas and Rainier Avenue. And yeah, before we had the birth center, we would basically we would provide births, like home births. So we would do a lot of we have birth tubs, like inflatable birth tubs that we bring to clients' houses and do it there. And then we also, before we got the birth center in Renton, we would use their birth center as well. They have a bunch of birth tubs there and beds and all that. So that's where they would predominantly operate. But we also do care for people who do plan on giving births in hospitals. Like we provide the prenatal visits and also doulas. That's the biggest thing too. We provide a lot of doulas. We currently have this, it's called the Birth Bundle Project. And it's kind of like a pick and choose of various services that you can use during your pregnancy. You can get a doula, a birth assistant. You can get a midwife if you want, lactation support, social services. And then we just also hired a pediatrician so that they can transition the care really easily for at least the first year of the baby's life. So that's like our main service, I would say, that birth bundle project. And then kind of recently, like in the last year, we really expanded our services because we hired some certified nurse midwives. And basically, the difference between a licensed midwife and a certified nurse midwife is our licensed midwives mainly focus on births. And then our nurse midwives, they are more kind of like your doctor. They'll do annual and problem visits if you need like STI testing or birth control or something like that. So we'll have a provider for that. And so that's been really helpful because people don't have to get referred everywhere and stuff for different services. If they gave birth with us, they can continue to still see our provider even after way after they've given birth. If they needed like some birth control after that or something like that, then it was just a really easy transition into getting them those services instead of having to refer. On top of like if they wanted therapy or because especially dealing with postpartum depression and all of that. So yeah, we're really grateful that we were able to expand those services in that way because that way it's not like just referring people everywhere and it's still sticking to whatever insurance they have. So yeah, that's kind of just the big grand scheme of all the things that we do. But we're still growing. And like I said, we're going to be building that birth center over here in Seattle as well. But yeah, we just have the Renton one for now. That one's basically across the street from Valley Medical. And yeah, that's the summary of our services.
Thank you, Jade. That was like really informative. I wasn't aware that like with midwifery and doulas that you guys go into such a large categories of like pediatricians and the therapy and the yoga, and then they're after the child's birth. Like that's, I guess, news to me because I always just assumed it was just about the birth and pregnancy part. So you kind of mentioned like people of color being like at higher risk. So if they're like often that means that they're not like able to qualify for like the midwifery, and you kind of touched on how you guys are expanding that for people to qualify. Could you expand on that a little more?
Sure. Yeah. So yeah, with predominantly our clients are BIPOC families, and Tara made a report for her master's, basically surveying the 98118 area code and the birth outcomes of BIPOC families in this area code specifically, and saw that it was just a lot less successful, the rates of birth for BIPOC families in here. So yeah, she basically took that information, and that's why she wanted to start specifically in this area, a birth center. And I think another thing too that is really important about the work that the services that we provide, especially for BIPOC families, is just the level of care that midwives provide. It is much more intensive than seeing a doctor, because if you go to the doctor, you'll get like a 15-20 minute visit. It's just like a really quick in and out. They don't really get to know you that well. But with midwifery care, you're getting hour-long appointments. They really talk to you in depth and like ask you questions. They get to know you. They're really friendly. And like that level of care is, what is needed too for a lot of BIPOC people that are just not listened to in the hospital, or don't have an advocate. So yeah, like having the nurse midwives too and stuff, it's just been we've been getting a lot of good feedback, at least. Like some of our clients say that they wish that their midwife was like their doctor, because of how much that care is there and how much they're listened to, and just everything being met. So that's kind of the difference of the care that makes it more just providing like better outcomes for the BIPOC families and all that, specifically because of that. But yeah, that's kind of why the services are better in general.
Well, I'm just blown away by the information that you've, already provided and just all the services that you guys cover. And also, even culturally specific services. Um, I guess, could you talk to the point of what's the difference between a midwife and a doula?
Oh yeah, that is a really popular question. So the midwives are basically the trained personnel that like gone to school for years. It's like a lot of schooling you have to go through, and they're licensed to give birth essentially. And then doulas are not. There is certification for doulas, like the certain trainings and stuff, and they do attend the births. But they're basically there to kind of just guide you through the birth. Um, Before, during, and after. Some doulas don't do postpartum support, but yeah, they are kind of just like a lot of people like to use them if they do give birth in the hospital because having a doula is great for being an advocate. Um, so yeah, they'll advocate for their client. They'll guide them through the process of giving birth. They'll usually teach them like some of our doulas will like teach them certain meals that they can make at home. And it's just like a really personal kind of relationship that is built with doulas and their clients. And then also with the postpartum support, doulas will keep seeing you all the way for weeks and stuff to like help you basically rejuvenate after giving birth. Um, so yeah, but with midwives, it kind of stops after birth. I mean, they'll do some appointments after that, but for the most part, they just focus really on the birth.
Thank you.
Thank you for explaining that. I have a question that it made me think of because when we hear midwife and doula, it kind of makes you think that the field is female dominated. Is there males in this field, or is that something that you guys have in the agency in your center? Because
Yeah,
I
it's
know.
actually pretty. It is pretty female dominated for sure, but we do have a lot of like trans and queer people that we work with. We do have a couple like there's like for the doulas at least and stuff. We do have like there is a trans male doula, but for the most part, yeah, it's I've yet to work with like an act like a male identifying person that like in the birth world and stuff. So, but yeah, that would be the extent of like the how diverse it is.
Okay. Um, this isn't on the question list, but I guess I think it's also very relevant in terms of, um, I've seen across social media that it has picked up in terms of midwifery and doulas, and that showing a trend, and it seems like a lot more people are starting to go towards that way, and I think that's really good, but have you seen that uptick, and what do you think about that, that trend, and what do you think that means for, you guys and for, other people that are doing midwifery and are doulas?
Yeah, that's a good question. Yeah, I mean, it definitely is getting popular. I know that in 2020 specifically, it got really popular because a lot of people wanted to not go into the hospital, obviously, for the pandemic and all that going on. So, home births became really popular during the pandemic. Um, and yeah, I think a lot of times people just aren't, um, they just don't know that these services are there for them. And so that's kind of why, yeah, I don't know. A lot of people just see midwifery and think like, oh, that's for like rich people or like more privileged people. And so like more and more people are seeing now it's like, oh, you can use your insurance for this. And like, I mean, all of our, well, not all of our, but a lot of our clients are like on Medicare and stuff. So we're like, we're offering this, cheaper alternative to giving birth in a hospital. And yeah, it's definitely getting popular because it's word of mouth, really, especially with the communities that we serve. We serve a lot of like immigrant population, and so they definitely have their circles, and that gets a lot of popularity. Um, and yeah, I don't know. I'm honestly really glad because before I worked here, I didn't really know much either about midwifery, and the more people learn about it, I think the less it's going to be like, I guess less people are going to be like fearing of it. Because I think, yeah, there's just a lot of myths that have to be dispelled. Like a lot of people still don't think that like home births are even safe. But yeah, I mean, the thing is like, this is what our ancestors did and how they give birth and stuff. And a lot of our clients, especially like in our immigrant population, have experienced births like natural birth and all of that at their home countries, or their family members have given birth like that. So just dispelling those myths is probably the hardest part about um, doing outreach and getting this more popular. But it is growing. It's definitely growing.
Yeah, so I guess it makes me think, when we talk about like the medical field, which is um well, I shouldn't say the medical field, but like the hospital, um, that's like is usually predominantly like male doctors or so. I know recently I'd been reading an article and it was talking about the push for C-sections and things like that. So I mean, I don't know if you could speak on it, but uh, do you know if that's like what the rates are between if you decide to do like a home birth or one at a health center opposed to a hospital with the
For
referrals?
sure. Yeah, definitely. So we actually don't do C-section. So if somebody um, needs a C-section due to like medical reasons and stuff, like we wouldn't be able to operate that. And then we also don't do epidurals. Um, so yeah, that hospitals do that. But yeah, basically for all of our clients, I mean, yes, we want to push home births as much as possible and natural births, but we have to be reasonable if it's like we've had clients where it's like it's just not medically sound for them to give birth at home or in a birth center, like they have to be at a hospital. So we'll use our judgment for sure when that should happen. Um, and yeah, I mean that's something too that I've been like looking into in terms of the C-section rates in hospitals and all of that. And yeah, I was just watching this great documentary recently on Hulu. It's called Aftershock, and it's basically about just like the medical, or yeah, just the birthing rates for BIPOC families across the country. And one of them important, like I guess, yeah, one of the quotes that stuck with me was basically the main person was just saying like, it makes sense that their C-section rates are high in hospitals when you have a bunch of surgeons doing births. Like these people are doctors or surgeons, like they're not. And also on top of that, it's like they'll get more money paid out insurance wise if they do C-sections, and it's just faster, and people have doctors are in and out all the time, like very busy. So it helps them time wise too to just do C-sections instead of doing a full like natural birth. So that was very interesting to me because I was like, yeah, that does make sense actually. Like if you're gonna put a room full of surgeons and doing, have them in control of births and stuff, then for sure they're gonna go for what they know and do surgeries and stuff like that. Um, and yeah, we just don't do the C-sections. That is something that is in the hospital, but we would recommend maybe getting a doula for better, patient advocacy and all that. But yeah,
Yeah, I kind of want to go back to even that question when you were talking about how there are some myths and getting it pushed out more that getting midwifery, a doula, or going through that process, and also you did a good job of telling all the different services, the hour long, and having a pediatrician for even a year after the child is born. Like those are really great services. But what would you say to dispel those myths, or I guess if there was somebody on the edge of should they try at a home birth or should they try the hospital, what would you say to those people, and give them the confidence that it would be okay to go into and do the at home birth?
yeah. Well, my go-to is always, yeah, this was existing before the time of even hospitals and doctors. And like, I mean, even my grandma gave birth, like, it's not that far away. We're not that far away from the time where where midwives were much more popular than doctors and everything. But I always also like to tell people who are on the fence, like, you have options. You always have options, and we're never going to force you to do anything. Or, like, and like I said before, if it's not medically sound for you to give birth at home, like, we're definitely very cognizant of that. Because yeah, as much as we want to, push midwifery, we take really precaution on it. And um, yeah, that's mainly what I say. We also do like meet and greets too with the midwives and stuff. And those, like I said before, like our appointments are like an hour long, so they get to answer all the questions that they have. And yeah, I don't know, just providing them all the options, because no matter what, we want our clients to have like as much choice and as possible for themselves. Um, Maybe Trinity could also speak a little bit more too, about how she would go about it, like provider wise. But yeah, I mean, just making sure that the client knows that it's like sound and safe, and especially with our birth center in Renton, that's right next to a hospital. So, and that was on purpose, just in case, but that gives people much more. That definitely gives people like more confidence when they hear that, when they know that it's like right next to the hospital. Um, but yeah, that's kind of what I do to try to dispel any myths and stuff. But yeah, like I said, Trinity might be able to speak a little more.
Okay. Thank you.
I think that most of the other questions are about the services, but if you like, Jade, to talk a little bit about, why you joined the organization, or what your experience has been.
Yeah, definitely. So yeah, I am new to the birth world. And a lot of people say it's only a matter of time until I become a doula, because that's like just a really easy kind of segue into getting into the birth world. And maybe I will someday, but for the most part, so I do the community outreach. I'm a community outreach coordinator. That's my title here. And then I also do like marketing and stuff like that. But how I got into this was I did a lot of community organizing before. I used to be in Seattle DSA, Democratic Socialists of America, and one of my comrades told me about this position. I was like, at the time, I was just working at a corporate like biotech company, so I was like, okay, I'm definitely down with this whole vision of this organization and everything. And yeah, when I really saw just how much they like to include kind of like restorative, transformative principles, and all that, I was like, okay, yeah, I definitely want to work for an organization like that, because it was just so up to par with my beliefs and everything. So that's kind of how I got involved. And then like through my organizing and stuff at DSA, and then other mutual aid stuff that I would do, they were like, oh, well, it seemed like, the lay of the land a little well, when it comes to like leftist stuff in Seattle. So yeah, they were like, you should, yeah, they hired me for probably that reason, because I'm like, have a lot of networking and all that. But yeah, I didn't, I mean, my connection to midwifery from before that, like I know my great grandma has given birth naturally. She's from the Philippines. So, and that's just how all my like grandparents and like my like great aunts and all that were born as well and stuff. So I was like, oh yeah, like this is something that we've done. This is something like that our ancestors did. Like this is, yeah, just a really connecting way to get back into that kind of those practices again. But yeah, that's how I stepped into it. But I mean, now that I'm in this birth world, I'm like, I don't want to get out. I definitely want to keep working in this field no matter what. So it's definitely changed my just like my view on where to work and everything now. Like, yeah, it's good.
I really like that story, the connection of family and the past and how it's influencing this experience, and really dope.
Thank you.
Where could we get in touch with you, and how could our listeners follow up with you guys if they were interested in midwife or doula service.
Yeah, definitely. So our website has all the information, myrvcc.org. We're also on social media. On Instagram, we're still Rainier Valley Midwives, but Facebook, we're Rainier Valley Birth and Health Center. To set up a meet and greet appointment, you can reach out to info@myrvcc.org. And that's the front desk. They can get you set up with whatever you need, whether it be a meet and greet for pregnancy, a prenatal appointment, or if you wanted to just see a nurse midwife and get some reproductive care taken care of, then yeah, that would be the first people to reach out to. And then yeah, if for other like media stuff, like I'm in charge of that. So my email is just jade@myrvcc.org. And I'll be taking stuff like this all the time. We're pretty present in the community in terms of like tabling and going to festivals. I think the next one we're going to is like a family resource night from Project Be Free. That's going to be on, I forgot the date, but that's in like, I think that's next week as well. And yeah, so we're kind of out there too, just at various health fairs and whatnot. And I'll probably be the person there. And yeah, that's how you can get in touch with us. And yeah.
Thank you, Jade. And is there anything else you would like to share, or any thoughts at the end that you'd like for us to know?
Yeah, I mean, I always just like to, as much as possible, recommend, even to like my friends and family, if there is midwifery services in your area, like definitely get it, like use them, because, and even if you're not pregnant, I tell my friends all the time, like if you need to get tested or something, like come to my job because the appointments, just the level of care, I've just never experienced it before. Like it's definitely worth it. You feel heard. You can get everything you need taken care of. Like they got you. But yeah, as much as possible, I always recommend it. Even like my mom, she lives in Southern California, and I'm like, try to get involved with like if you need any, because they do till menopause and stuff usually, like nurse midwives. So yeah, definitely if you have a midwifery services in your area, get involved, or you can get involved with us. We're always accepting new clients and all that. So yeah, that's just my little soapbox for midwifery plugs.
Well, thank you, Jade.
Thank you, Dave.
Yeah, you're welcome. Thank you.
And thank you all for listening. And this has been Confabulation. Again, we are from our sister's house. And if you or anyone you know is experiencing domestic violence, call our hotline at 253-383-4275 or visit our website at oursistershouse.com. Thank you.
Thank you.